La PNQ du jour, messieurs, c'est à vous, bonjour.
Bonjour Tia, bonjour à tous. Jagdish Joypal, bonjour.
Bonjour Nawaz, Tia, bonjour, tous les auditeurs et internautes, bonjour.
Voilà donc session spéciale consacrée aux travaux parlementaires, à la reprise des travaux parlementaires ce matin. Entre-temps, Jagdish Joypal finira beaucoup de développement. D'abord, la deuxième vague du Covid-19 à Maurice. Et puis, bien sûr, les chamboulements au sein de l'opposition, mais aussi dans les rangs de la majorité avec la démission de 2 ministres.
Certainement, Nawaz, donc le Parlement, l'Assemblée nationale peut reprendre son activité après 3 mois et 7 jours de vacances, donc avec en toile de fond une crise sanitaire, donc la seconde vague, comme le ministre de la Santé lui-même peut qualifier ça, la seconde vague du coronavirus, avec aujourd'hui 216 cas qui nous finissent atteindre donc ce matin. Mais la politique qui peut reprendre ses droits, donc après sa bonne vacances qui est marquée par beaucoup d'événements pendant la trêve même, nous avons dire la trêve politique. Finalement, il y a 2 ministres qui ont démissionné, Nando Boda et Yogita Surminaden. Finalement, une recomposition de l'opposition avec Xavier Duval comme un nouveau leader de l'opposition, Patrice Armand du PMSD également, qui peut remplacer Shakil Mohamed comme un whip. Et en même temps, finalement, la démission de 3 membres du Parti travailliste, du comité parlementaire, de l'ICAC pendant sa période de 3 mois-là. Donc, en toile de fond, Parlement réuni avec une situation de plein confinement, députés toujours pour masquer, alors pareil comment l'année passée. Et question, c'est-à-dire l'opposition qui demande une séance consacrée uniquement au Covid-19, donc c'est-à-dire à la crise sanitaire. Même si ça n'a pas fini d'accepter, Nawaz, les 14 questions qu'il pose le Premier ministre ce matin et qu'il pour répondre, il y a 12 questions qui sont adressées à Pravin Jagnnath et qui concernent Covid-19. Différents aspects, donc surtout une disposition qui peut prendre, respect ou non-respect protocole sanitaire, jet privé qui peut venir, délégation indienne qui fait venir Maurice, donc en déplacement, tout ça pour faire objet de différentes questions. Il y a également la PNQ.
Oui, la Private Notice Question, donc la première du nouveau leader de l'opposition, Xavier Duval, adressée au ministre de la Santé, Kailesh Jagatpal. Question à 4 volets, Jagdish.
Oui, Xavier Duval peut questionner le ministre de la Santé, il peut vous les connaître, différents vaccins qui peut administrer à la population et il a également demandé quand est-ce que 70% de la population pour recevoir la deuxième dose. Et là, un élément important, Xavier Duval mentionne 70% de la population alors qu'ils escalèrent, Manis Gobin, il fait mention de 60% de la population, ce qui représente environ 720 000 Mauriciens qui ont besoin de vacciner, donc pour nous atteindre sa seuil de 60%. Maintenant, si c'est 70%, nous ne pas trop connaître comment ça pouvait. Il voulait également qu'on ait un nombre de personnes âgées qui sont donc dans le pays et qui souffrent de diabète et de problèmes cardiaques qui finissent vacciner. Déjà, donc Xavier Duval qui demande également si le consent forme pour amender. Et là, nous avons dit à Nawaz, il y a beaucoup de polémiques. Nous évoquons ça vendredi dernier. Et dans l'émission Cœur de l'info, nous pouvons continuer à évoquer dans différentes émissions, c'est-à-dire le formulaire de consentement qui chaque citoyen qui a le vacciné bien signé, côté là, il peut avoir droit de faire une réclamation en cas de négligence médicale, en cas de effet contraire du vaccin.
Alors, nous avons ça PNQ à 4 volets, un par un. Donc, d'abord, différents types de vaccins qui peuvent administrer à la population mauricienne. Alors, jusqu'à ce week-end qui finit passé, finit administré le vaccin AstraZeneca de l'Inde. Et depuis hier, peut administrer le Covaxin qui sortit de l'Inde également. Et hier, en conférence de presse, le docteur Zubair Jumaï fin aussi cause du vaccin chinois, du vaccin russe Sputnik. Donc, Maurice Jagdish peut jouer tout un tableau. Donc, tout un vaccin qui est disponible et qui fin passe ben essai clinique, ça un vaccin là, d'après le docteur Diomaye pour capable être administré à la population mauricienne.
Oui, et il y a 6 types de vaccins qui peuvent produire dans le monde actuellement. Nous avons AstraZeneca, qui est un produit anglo-suédois, produit sous licence en Inde. Nous avons Covaxin, également produit en Inde. Et Sinovac, la Chine. Et Pfizer, Moderna, c'est l'Amérique. Johnson Johnson, l'Amérique. Et Sputnik, la Russie. Alors, il y a tout garanti qui, surtout le comité national, le Covid-19 peut donner nous, dans le sens que tout ce type de vaccin-là, ont une efficacité. Même si certains vaccins pas encore reconnus par l'Organisation mondiale de la santé, il y a une institution dans un pays, chaque pays, il y a donc une norme qui est respectée quand il accepte produire un médicament et accepter de mettre-le sur le marché. Ça, c'est un spécialiste qui peut dire, pas nécessaire attendre l'OMS parce que l'OMS prend un peu plus le temps, surtout dans le contexte actuel. Alors, donc, AstraZeneca, nous fini une première phase, pour une deuxième phase pour les gens qui sont déjà vaccinés, environ 100 000 Mauriciens qui ont gagné ça. Maintenant, Covaxin, il a commencé depuis hier, environ 7 000 à 9 000.
6 000 et quelques administrés hier.
Il a administré hier, donc pas fini, il a trop de réticence. Et nous remarquons qu'il y a beaucoup de Mauriciens très enthousiastes pour accepter le vaccin parce que pour les Mauriciens, la priorité, c'est nous combattre la crise et donc nous faire face. Chacun protège lui-même et les protège Bandimoun qui est dans son entourage et son voisinage.
Deuxième volet de la question, donc quand pour atteindre 70% de la population, et là on finit mentionner Jagdish, le docteur Zubair Diomaye, le gouvernement peut dire 60% suffit pour atteindre l'immunité collective, alors qu'Isabelle Duval évoque le chiffre de 70%. Et hier, en conférence de presse, le docteur Zubair Diomaye finit dire que le rythme auquel la population peut être vaccinée, il pensait d'ici juin, nous pourrons atteindre les 60%.
Oui, donc c'est un rythme qui peut accélérer avec le nombre. Donc, surtout AstraZeneca, il a beaucoup plus vite, final environ 9 000 et 8 000 à 9 000. Là, hier, le premier jour, et vous mentionne le chiffre d'environ 6 000 quelque chose, alors qu'il est publié ce matin. Maintenant, nous connaissons sa campagne-là, donc c'est continuer jusqu'à le mois de juin, qui veut dire, c'est-à-dire l'immunité collective, c'est-à-dire une partie, forte partie, un pourcentage majoritaire de la population qui est une fois vaccinée, donc nous sommes capables de protéger l'ensemble du pays, donc c'est-à-dire, et le reste de la population qui n'est pas encore vaccinée, c'est-à-dire les 40%. Ça, c'est un expert qui peut expliquer ça, et il fait faire mention à l'étranger, dans tout bon pays, c'est le seuil de 60% qui a besoin vacciner pour atteindre donc l'immunité collective.
Voilà, donc le speaker a fait son entrée au sein de l'hémicycle. La séance va donc démarrer.
Announcements.
Mr. Speaker, sir, it is with deep regret that we learned of the demise of Mr. Mayendra Uchana, former Member of Parliament, on 1st of January last at the age of 70. Mayen Uchana, as he was commonly known, was born on 29th December 1950 at Poudredo Hamlet. In 1973, he proceeded to India to pursue tertiary education at Pune University. During his university studies, he assumed responsibilities of President of the Mauritius Students Association and Secretary General of the Symbiosis Student Council. In 1976, after the completion of a Bachelor of Arts in English, he returned to Mauritius and started working as an English teacher at Paten College in Brazil. He began his political career in the same year by joining the MMM. In 1976, he contested the general elections in constituency number 7, Piton, Rivière-du-Rempart, under the banner of the MMM, but was not elected. In 1979, he took a job as principal at Progressive College in Rivière-du-Rempart, a position he held until 1983. In 1982, he stood as a candidate for the general elections in constituency number 7, Piton Rivière-du-Rempart, under the banner of the MMM-PSM alliance, and was elected third member. In 1983, he left the MMM and became one of the founding members of the MSM as a result of the split within the MMM. He was appointed Minister of Energy and Communications in the same year. He was entrusted with the post of Treasurer of the MSM, which he held until 1995. In August 1983, he contested the general elections again in constituency number 7 under the banner of the MSM Labour Party Alliance and was elected third member. He was reappointed Minister and held the portfolio of Energy and Internal Communications. Mr. Speaker, sir, in the general elections of 1987, Mr. Uchana was returned third member to serve constituency number 7 under the banner of the MSM Labour Party Alliance. He was reappointed Minister of Energy and Internal Communications. In 1991, he ran for the general elections in constituency number 7 under the banner of the MSM-MMM Alliance and was returned third member. He became Minister of Energy, Water Resources and Postal Services, a portfolio he held until October 1994. Mr. Speaker, sir, Mr. Uchana was also known for his social activities and was engaged in charitable work at the Human Service Trust. He was associated with the setting up of the Ayurveda Hospital of the Trust in 1985. Mr. Speaker, sir, committed to the concerns of the people of Indian origin settled in different parts of the world, Mr. Uchana became a member of the Mauritian branch of GOPIO, the Global Organization of People of Indian Origin, in 2001. In 2012, he became the chairperson of the Apravasi Ghat Trust Fund, and in 2013, the chairperson of GOPIO International. Mr. Uchana was instrumental in the setting up of the International Indentured Girimityas Foundation, which was incorporated in 2016. Mr. Speaker, sir, may I request you to kindly direct the clerk to convey the deep condolences of the Assembly to the bereaved family.
Mr. Speaker, sir, in my name and that of the opposition, we associate ourselves with the tribute made by the Honourable Prime Minister to late Mr. Mayan Uchana, and I also request the clerk to convey our condolences, our sincere condolences, to the bereaved family.
Honourable members, I associate myself with the tribute paid to the memory of late Mr. Mayan Uchana, former Member of Parliament, by the Honourable Prime Minister and the Honourable Leader of Opposition, and I direct the clerk to convey the deep condolences of the Assembly to the bereaved family.
Papers have been laid. Questions?
Mr. Speaker, sir, the PNQ is addressed to the Honourable Minister of Health. whether in regard to the COVID-19 vaccination campaign, he will state A, the different types of vaccines that will be administered to the population, B, when it is expected that 70% of the population will have received 2 doses of the vaccine, C, the percentage of senior citizens, persons suffering from diabetes and heart diseases who have been vaccinated as at to date, and D, whether the consent form will be amended.
Mr. Speaker, sir, I have to thank the Honourable Leader of Opposition for giving me the opportunity to enlighten the House and the population at large on our vaccination programme. In July 2020, the Ministry of Foreign Affairs, Regional Integration and International Trade informed my ministry that there was a proposal from the global islands for vaccines and immunization, inviting Mauritius to submit a non-bidding expression of interest for the procurement of COVID-19 vaccines being developed by several international pharmaceutical companies. After consultation with all relevant stakeholders, my ministry entered into an agreement with the Gavi Alliance. The agreement provides for the procurement of the vaccines to cover 20% of the population. In a bid to ensure that more than 20% of the population, that is at least 70%, would be covered, my ministry sought information on availability of vaccines from other manufacturers of candidate vaccines. The African Union is also facilitating the procurement of COVID-19 vaccines for AU members countries through the Africa Medical Supplies Platform. The latter has informed my ministry that the allotment for Mauritius would be 199,682 doses, of which 48,551 from Pfizer and 151,231 from Johnson & Johnson. Mr. Speaker, sir, on 16 December 2020, my ministry wrote to other manufacturers, namely AstraZeneca, Oxford, Pfizer, Moderna, Gamaleya Research Institute, seeking information in respect of the process and modalities for the procurement of each vaccine, the prices thereof, the supply chain, the temperature requirement, and the scheduled delivery of the vaccines. Pfizer requested my ministry to enter into a non-disclosure agreement, which my ministry did. Thereafter, a working session webinar was held with representative of Pfizer on 7 January 2021, and my ministry was also requested to make an official request. The ministry submitted a request for the procurement of 1 million doses of Pfizer vaccines and requested the manufacturer to inform about the terms and conditions, delivery schedule and pricing. However, no conclusive deal was reached with any of the manufacturers. On 16 December 2020, the Ministry of Foreign Affairs, Regional Integration and International Trade requested my ministry to inform as to whether we intended to procure Oxford AstraZeneca COVID-19 vaccines manufactured by the Serum Institute of India under the brand name Covishield. The Covishield vaccine has been validated by the WHO. It is administered in 2 doses, with the second dose being administered after 8 to 12 weeks with more efficacy. Mr. Speaker, sir, according to the World Health Organization, the AstraZeneca COVID-19 vaccines have an efficacy of 66.7% against symptomatic SARS-CoV-2 infection after administration of 2 doses. It was found that the vaccine efficacy increased significantly when the interval between dose 1 and dose 2 was longer than 4 weeks. Efficacy dose of the first one has been shown to be as high as 76% through at least 12 weeks after vaccination. Mr. Speaker, sir, on 13 January 2021, after consultation with the Ministry of Foreign Affairs, my ministry wrote to the Director of Serum Institute of India, signifying our intention to procure 1 million doses of Covishield vaccine and requesting information in respect of the price per unit of the vaccines, the time frame within which the vaccine could be made available, and the terms and conditions attached to such procurement and delivery. Following exchange of correspondence between my ministry, Ministry of Foreign Affairs, and the High Commission of India in Mauritius, my ministry submitted an emergency use of Covishield vaccine to the Serum Institute of India through diplomatic channel. On 26 January 2021, a safety data exchange agreement was signed between my ministry and the Serum Institute of India. The purpose of the safety data exchange agreement was to describe the procedures and to define the responsibilities between my ministry and the Serum Institute of India. The Indian authorities informed the government that they would make a donation of 100,000 doses of Covishield vaccines to Mauritius to enable us to kickstart our vaccination program. The consignment reached Mauritius on 22nd January 2021, and our program started on 26th January 2021 in Mauritius and on 6th February 2021 in Rentrée. Mr. Speaker, sir, on 27th January 2021, a firm order was placed on the Serum Institute of India for the purchase of 300,000 doses of Covishield vaccines, that is 100,000 doses to be supplied in February 2021, 100,000 doses in Q1 and 100,000 doses in the second quarter. A vaccine purchase agreement was thereafter signed between my ministry and Serum Institute of India on 15 February 2021. On 21st February 2021, the first consignment of 100,000 doses of Covishield vaccines reached Mauritius. The second consignment of 100,000 doses of Covishield vaccine is expected in mid-April 2021 and the last consignment by end of June 2021. Mr. Speaker, sir, my ministry finalized a national deployment and vaccination plan for COVID-19 vaccines with the support and collaboration of WHO and other stakeholders. The plan, which was approved by the government in January 2021, highlights the target population, including Rodrigues and Agaliga, and is as follows. Priority 1 covers 15,000 frontline healthcare workers, 5,000 frontline police and prison officers, and 25,000 other frontliners. Priority 2 covers 9,000 healthcare workers from public and private sectors, 10,000 personnel from the Mauritius Police Force, and 52,000 other essential workers. Priority 3 covers persons above the age of 60 years, and Priority 4 covers adults with at least 2 comorbidities, residents of dedicated homes, teaching and non-teaching staff of educational institutions, firefighters, staff of supermarkets, bank, front office personnel, and scavenging personnel. Mr. Speaker, sir, the vaccination program started with the frontliners, that is, the medical staff, port and airport staff, and staff of the tourism sector. It continued with the vaccination of the senior citizens and patients with 2 comorbidities. However, with the lockdown, the vaccination program was targeted for persons who had been granted for work access permit. As from 17th March 2021, the EDB MRU platform has been created to register applications for vaccination from business operators, including SMEs, general retailers, grocery stores, planters, vegetable growers, animal breeders, fishermen, and all operators dealing with the general public. Mr. Speaker, sir, with regard to the administration of the vaccines, initially, the vaccination was being carried out in the 5 regional hospitals, with a view to ensuring that any person showing signs of adverse reaction could be given immediate medical attention. Subsequently, in a bid to scale up the vaccination program, vaccination was carried out in other settings, having medical posts or medical facilities such as the port, airport, police posts, hotels, and other tourist resorts. Given the high response shown from the public to be vaccinated, and in order to carry out the vaccination in a more conducive setup, vaccination is now being carried out in large spaces such as stadium, village halls, sport complexes, gymnasium, and conference centers. Mr. Speaker, sir, my ministry, through the Ministry of Foreign Affairs, also approached the Russian authorities with a view to securing supply of the Sputnik vaccine. My ministry was subsequently advised to send our request to the Russian Direct Investment Fund, a Russian government agency responsible for the commercialization of the vaccine. My ministry therefore approached the Russian Direct Investment Fund through the Ministry of Foreign Affairs on 16 December, and we had been informed that the Russian Direct Investment Fund is agreeable to provide 250,000 doses of the Sputnik vaccine. For this purpose, a draft agreement, a non-disclosure agreement, and a draft supply agreement have been signed with the Russian Direct Investment Fund. On 19 March 2021, the Russian Direct Investment Fund has informed that a first shipment of vaccine would be made possible as soon as a registration with the Federation is complete, and subsequently other shipments would follow at regular intervals. Mr. Speaker, sir, on 5th March 2021, the High Commission of India informed my ministry that vaccines against COVID-19 manufactured by Biotech India Limited and commercialized under the brand name Covaxin was available for procurement by Maurice and submitted relevant documentation regarding sale. The information was submitted to the National COVID-19 Vaccination Committee, which gave its approval for the use of Covaxin. My ministry submitted an emergency use authorization to the company and a purchase order of 1 million doses. The company informed my ministry that 230,150 doses of the vaccines were available immediately at the rate of USD 15 per dose and for a total amount of USD 3,452,250. Payment was effected through the Bank of Mauritius. On 18th March 2021, my ministry was informed that due to export restrictions on vaccines, the government of India has authorized the sale of only 200,000 doses. The consignment reached Mauritius on Friday 19th March 2021. Mr. Speaker, sir, the vaccine commercialized under the brand name Covaxin has been approved by the Drugs Controller General of India for emergency use. In Mauritius, the Trade and Therapeutic Committee and the Pharmacy Board have also approved the emergency use of the vaccine. Covaxin has recently completed its third phase of clinical trial, and as per data available, its efficacy is 81%. The vaccine has already been administered to millions of people in India and some other countries. As of date, no adverse event following immunization has been registered in any country. Mr. Speaker, sir, on 12 March 2021, my ministry also was informed by the Ministry of Foreign Affairs that the government of the People's Republic of China has agreed to make a donation of 100,000 doses of vaccines to Mauritius. The National COVID-19 Vaccination Committee has given its approval to accept the brand Sinopharm. In this context, my ministry will have to sign a letter of commitment for the receipt of the donation and submit the authorization of emergency use and liability execution. My ministry is seeking all necessary clearances before signing the undertaking. In a nutshell, Mr. Speaker, sir, we can safely say that Mauritius will be provided with vaccines of different brands and at different time intervals, either as donations or procured on a commercial basis as follows. COVAX facility, 507,200 doses with delivery to be confirmed. Serum Institute of India, 100,000 doses, donation already received. Serum Institute of India, 100,000 doses, procured, already received. Serum Institute of India, 200,000 doses, procured on order. Covaxin, 200,000 doses, already received. Sputnik, 250,000 doses on order. African Union, 48,551 doses on order, Pfizer, and 151,231 on order from Johnson & Johnson. China Sinopharm, 100,000 doses, donation awaiting delivery. Total, excluding the Johnson & Johnson, it's 1,455,651 doses to cater for the vaccination of 727,825 persons. J&J vaccines, 151,231 single-dose vaccine. With these numbers of vaccine, a total of 879,056 persons can be vaccinated, representing to 82% of the adult population of Mauritius. Mr. Speaker, sir, the House would be glad to know that even today, while going through the private notice question, we have been informed by the Mauritius Embassy in Russia that the Russian Direct Investment Fund has agreed to supply 1,250,000 doses of the Sputnik vaccine in 2 equal consignments. This shows our commitment to have recourse to all necessary diplomatic channels and our long-standing amicable bilateral relationship in order to have sufficient doses of vaccines to protect our population. Mr. Speaker, sir, with regard to Part B of the question, my ministry has worked out 2 different scenarios. Scenario 1, with the vaccination of 10,500 persons per day, it is expected to immunize 62% by August 2021. For scenario 2, with the vaccination of 12,500 persons per day, it is expected to immunize 74% of the population by August 2021. I wish to inform the House that the vaccination team of my ministry and the private clinics have the capacity to administer the vaccines up to 12,500 to 13,000 persons per day. However, the program will depend on the timely delivery of the vaccine from the various suppliers. Mr. Speaker, sir, with regard to Part C of the question, I wish to reassure the House, the Honorable Leader of the Opposition, that our senior citizens remain a priority for this government. Preventing them from being infected with the virus is a constant objective of my ministry. The resurgence of the virus and its consequences has compelled us to take a decision regarding pursuing the vaccination of the elderly. On the sanitary side, it seems very risky to continue vaccinating the elderly in the centers, even by maintaining all hygienic measures without exposing our elderly and getting the risk of them being infected. Our government chose to stop the vaccination in order to better protect them. I wish to inform the Leader of the Opposition that confinement and sanitary measures are the best preventive measures against COVID-19. Once the resurgence of the virus is controlled, the vaccination of the senior citizens and patients with comorbidities will resume without delay. Mr. Speaker, sir, I'm informed that 18,034 out of 228,284 senior citizens have already been vaccinated, and this represents 8% of senior citizens. With respect to persons suffering from diabetes and heart diseases, I'm informed that around 100 persons have been vaccinated. These figures do not include senior citizens and patients with comorbidities who have been vaccinated in the private clinics. These figures of the latter have yet to be compiled and submitted to my ministry. The House will recall that with respect to Part A of the question, I stated that with the lockdown, the vaccination program for senior citizens and patients with comorbidities was put on hold, and the program was targeted with the work access permit. The House will also note that holders of WAP include senior citizens. Mr. Speaker, sir, with regard to Part D of the question, I have to inform the House that COVAX facility conveyed to my ministry 3 conditions for Mauritius to be enlisted for the supply of vaccines under the facility. The first one is product labeling. The model packaging for label for vials for COVID-19 vaccine that will be supplied through COVAX facility was submitted for the ministry to inform whether the model label is in line with the statutory requirements. The pharmacy section informed that there would be no need to amend the Pharmacy Act as Mauritius complies with the labeling requirements. Moreover, there is no import restrictions on vaccines. Second, the second condition is product liability risk. Manufacturers have expressed reluctance to deliver COVID-19 vaccines to countries participating in COVAX facility unless product liability risks are adequately addressed through an agreement with the manufacturers. However, Mauritius, being a high-income country, does not fall under the list of countries which have to sign such an agreement. The third condition is compensation fund. The World Health Organization and Gavi also submitted a draft briefing note. Indemnification for COVAX that requires high-income and middle-income countries which are considered to have the financial means to provide adequate compensation to individuals who sustain unexpected severe adverse events to adequately indemnify manufacturers and other stakeholders. Hence, it would be advisable to establish a compensation mechanism to compensate individuals suffering from adverse events associated with COVID-19 vaccines distributed under COVAX and to pay any legal awards in that regard against the indemnified entities. I wish to inform the House that the three of the manufacturers of the vaccine who have supplied or will supply vaccine to Mauritius, namely the Russian Direct Investment Fund, the Chinese authorities, or the Serum Institute of India, have also made it a condition precedent prior to the supply of any vaccines to have the following clauses. First, no claim clause. Second, a hold harmless clause. And third, a no liability clause. My ministry normally has recourse to a consent form which safeguards the ministry from such effects of vaccines like fever and mild rash. However, for the COVID-19 vaccine, a no-fault compensation should be established for severe adverse events or rare disorders arising out of use of vaccines, death, or disability. The fund should clearly indicate that affected people would either have recourse to the compensation scheme or to a lawsuit and not both. The ceiling of the fund has to be capped by my ministry. After discussions with the Attorney General's office and other stakeholders, it was agreed that regarding the indemnity for the manufacturers, a consent form would be elaborated. Any compensation that the state of Mauritius may be found liable to pay to any person would be made under the consolidated fund. Mr. Speaker, sir, it is not proposed to bring any amendment to the consent form. The consent form has been designed according to what obtains in the US, including the state of Florida. I will table a copy of the Florida state consent form. The vaccination form and the vaccine are voluntary and not mandatory. Manufacturers of the vaccine have had to develop vaccines in an expedited timeline, that is 1 year out from the threat of the pandemic instead of the usual 5 years. The UK government has passed regulations reducing legal protection from anyone injured by COVID-19 vaccine approved for emergency use. One of the reasons for such a decision was to encourage companies to aggressively invest and back vaccine development. The legal immunity covers companies supplying the vaccine, all health workers injecting the vaccine, and the NHS Trust and Foundation that employ the health workers. Consumer protection rights still apply for people injured by COVID-19 vaccine as the UK government was not allowed to take away those, COVID-19 vaccines have been added to the existing damages fund, which awards £120,000 to anyone who suffers 60% of disability as a result of getting a COVID vaccine. Further, in the European Union, Article 5 of Directive 2001/83 requires that member states lay down provisions so that marketing authorization, manufacturers and health professionals are not subject to civil or administrative liability for any consequences resulting from the use of an unauthorized medicinal product, or from the use of a product, or from the use of an unauthorized medicinal product, or from the use of a product otherwise than in accordance with its authorization when such use is by the licensing authority in response to the spread of pathogens. In France, Code civil provides as follows. Le producteur est responsable de plein droit à moins qu'il ne prouve ou que le défaut est dû à la conformité du produit avec des règles impératives d'ordre législatif ou réglementaire. Le producteur de la partie composante n'est pas non plus responsable s'il établit que le défaut est imputable à la conception du produit dans lequel cette partie a été incorporée ou aux instructions données par le producteur de ce produit. Mr. Speaker, sir, in view of the foregoing, the reply to part D of the question is no. The consent form will not be amended. I seize this opportunity to thank the Honourable Leader of Opposition and members of the Opposition who have graciously and voluntarily signed the consent form in order to be vaccinated on a priority basis. I also thank the members of the legal profession who, through the Bar Council, got vaccinated last week at Port Louis. All these barristers duly signed the consent form. Thank you, Mr. Speaker.
Mr. Speaker, it's now 12:06. The Minister has spoken at length on probably the most important issue that our country faces in the last 50 years. I hope that you will give the opposition adequate time to respond and take him to task, Mr. Speaker. Since August of last year, for the last 8 months at least, the Minister and his trusted advisor, Dr. Go, have warned repeatedly the population and us here in the House that the use of vaccines, in his own words, not approved and validated by the WHO, is dangerous, that it would be foolish to do so. PQ B612 and PQ B783. This is what the Minister said, Mr. Speaker. He said it would be catastrophic to purchase vaccines not validated. Maybe he is himself a catastrophe, I don't know. But he said it would be catastrophic to purchase vaccines not validated, Mr. Speaker. He is now the Minister. Mr. Speaker, this Minister is now proposing, is currently administering unvalidated, unapproved vaccines by the WHO. And in his own words, Mr. Speaker, these vaccines could have catastrophic effect on Mauritians. I'm asking him now whether he's not taking our citizens for fools.
Mr. Speaker, sir, I indeed stated that we would use WHO-approved vaccines back in December last year. The context is completely different. I also stated that we will not, I have to remind you, that we will not at any cost take our citizens for cobaye. Mr. Speaker, sir, today, once more in this House, I wish to reiterate the firm commitment we took and confirm that this government and my ministry will always stand by this principle. The scheme being deployed by the leader of opposition is clear. As I stated in my former interventions, some are indeed praying for us to fail in our management of COVID-19 situation. Their aim is merely to cause doubt in the mind of the population and to create confusion around the ongoing vaccination campaign. This is their aim. Mr. Speaker, sir, I wish to draw the attention of the House that as at date, the WHO-approved vaccines have not been given the green light for emergency use. Back in December, we were COVID-19 safe. As time went by, the situation evolved, both locally and internationally. We had the duty to consider the vaccination of our population. We had the duty to consider the vaccination of our population in order to continue to cater for their health and well-being. We also had to allow our economic activities to resume to their full capacity. And we also anticipated the global rush that we might have to face. That's true, in the procurement of safe and efficient vaccines. Again, back then in December 2020.
If you are going, on a point of order, if I may, if you are going to allow the minister to go on blah, 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 like this, already he has taken 20 minutes or more to respond in his formal reply. I think you have to be fair to us, Mr. Speaker. These answers have to be succinct, brief, to allow the opposition to ask the questions. Otherwise, we'll be done in 2 minutes after 2 questions.
Honourable Member, Honourable Leader of the Opposition, rest assured I'll give you some more minutes, number one. Number two, you've been a former Prime Minister, you know that I can't control answers of the ministers. Oh. Best wishes, best wishes. Shadow Prime Minister.
Mr. Speaker, sir, if the leader of opposition have to bear with me, even if he has catastrophic ears, I have to continue. Back then in December 2020, we did not have enough guarantee. It's very important to listen to this part, because back then in December 2020, we didn't have enough guarantee on the safety.
Order.
We didn't have guarantee on the safety of the available vaccines. And as soon as we are satisfied with safety and efficiency concern, we move for the procurement of vaccine. We have to understand this, that in December 2020, no one was aware which one of the candidate vaccines will be given approval. We were not aware. That's why we stated that we have to get vaccine that is approved. Let me finish. The vaccines being rolled out in Mauritius, they are safe and efficient. They have been validated by international bodies of repute, also by the Pharmacy Board, also by the Trade and Therapeutics Committee, and the Vaccination Committee. Mr. Speaker, sir, we acted fast, but not in a haste. Today, Mauritius is among the 20 countries in Africa having started the vaccination for their respective population. Now, if the leader of opposition is alleging that we have not been true to what we stated in December, he is again completely wrong. The COVID-19 pandemic is ever evolving, and we cannot stay idle at some suggesting. We have been constantly adapting our strategy to the changing situation. It's very important to understand why we have changed this situation. And I firmly believe...
Order, please. Order. Order.
I understand their frustrations, Mr. Speaker, sir.
Order, please. Order. Order.
They don't have anything to say about the government actions and the government program. That's why I'll quote John Patterson, American industrialist. If dead men can't change their minds, fools simply won't.
Speaker. Mr. Speaker.
Honorable Rezautim, be careful.
For the last 8 months.
Honorable
For the last 8 months. I'm trying, Mr. Speaker. I'm trying my best to keep calm in the face of such a catastrophe, Mr. Speaker. Mr. Speaker, since the last 8 months, we have been begging the minister, begging him to pre-order vaccines, reserve vaccines like the UK, the US, the European Union, Israel, you name it. We have been begging him to pre-order vaccines, reserve vaccines, so that he can take delivery once the vaccines are approved by WHO. He has stubbornly and negligently refused to do so, putting the population of this country at risk, both as to health and economically, Mr. Speaker, sir. And he dares to say that we have not done our work. We want this country, Mr. Speaker, to succeed. Therefore, Mr. Speaker, sir, I was not going to ask him to resign because we have a pandemic. But really, he ought to. But I'm going to ask him, Mr. Speaker, to give an unreserved apology to the nation, to this nation, for having been negligent, and putting our lives at risk and our economy at risk and the well-being of this population at risk. He has been negligent, Mr. Speaker. He must apologize.
So you have no question.
Will he apologize?
Mr. Speaker,
Do we have an answer?
should I request?
Statement? No answer?
No answer.
Move on to your next question.
Mr. Speaker, okay. Thank you very much. Mr. Speaker, I'm going now to ask about, I'll come back to many other important points with your permission, Mr. Speaker. I'm going to come now to this famous consent form, which has created so much anxiety in Mauritius. And I'm going to talk.
Why you sign?
I signed, Mr. Speaker. Don't laugh like a fool. I signed because I'm patriotic and I wanted to give the good impression. And I will sign it again. But I will say this, Mr. Speaker. The Attorney General misled the population when he was on TV. When he said...
Bear with me. Put your question. Don't make a statement.
Speaking for 10, 20 minutes...
There is one leader of the opposition I recognize in this House, Honorable Xavier Duval.
For the moment, sir, thank you. For the moment. Mr. Speaker, the Honorable Attorney General misled the population in a press conference when he stated, let me finish the question. Okay. Let me finish it. It's not long.
Finish the question.
He misled the population when he stated, and I have the consent forms here, and it's getting me very upset, because he stated, consent form pour vaccin, li pareil comme un consent form signé dans l'hôpital. I am going to table, Mr. Speaker.
So
the consent form. Sorry?
Question time. Where's your question?
Mr. Speaker, I am doing my work. If you are not happy, you can expel me, but I will do my work as I see fit. This consent form, Mr. Speaker, there is nothing here. It is consenting to information that is being given as to the issues that may arise. Nowhere in these consent forms, and this is where he has misled the population in the presence of the Honourable Minister of Health. Nowhere in this consent form are there any waivers.
Honourable Leader of the Opposition, try to understand my position. I'm here to regulate Parliament. If you don't have any question, I'm just sorry for you.
Mr. Speaker,
come with your question. Use the question time to put questions, not to make statements, Honourable Leader of the Opposition.
Thank you, Mr. Speaker, for your advice. But I'm unable to ask a question, a two-word question. I have to ask in the context. The context is this, Mr. Speaker. This is the question. Is the Honourable Minister aware that his colleague misled the population. Is he aware of that? Is he aware? Is he aware that the consent forms nowhere along in Mauritius do these consent forms have any waiver of liability? This is a question.
This is a long statement.
Well, what can I do? I have to explain, Mr. Speaker. I will be brief. Mr. Speaker, I have taken a Xanax before coming. I will be very brief with you. Don't worry, I'm not going to get excited. Now, this consent form does not have any waiver. These consent forms for admission, for blood transfusion, etc. Therefore, the Honourable Attorney General misled the whole population in the presence of the Minister of Health.
Honourable
Will he?
You're making insinuations and accusations. You know fully well. You're a full-fledged politician, leader of the opposition. You know that you have no question. Why don't you use this precious time to put questions?
It is extremely important. Will he now respond? Please respond now to the question as he raised the matter with the Honourable Attorney General.
Mr. Speaker, there is no question on my... Please, I'm willing to answer to question.
Point of order, please.
No honourable member can use the word mislead against any other member of this House. If the honourable member has misled if any member has misled the House,
Order.
The point is that the honourable member should come with a substantive motion reproaching the member for having misled the House. That's my first point. My second point is the honourable leader of the opposition cannot ask a question to the Minister of Health, asking him whether another minister has spoken the truth or not. This question should be addressed to the minister in question. A minister cannot answer for what another minister is alleged to have committed. This is out of order.
Honourable Leader of the Opposition, put proper questions.
Thank you, Mr. Speaker. Thank you. Mr. Speaker, on the 4th of February, a few weeks ago, the Honourable Minister of Health, Mr. Speaker, when the Titanic was sinking, people were playing the violin. Mr. Speaker, the Minister on the 4th of February, Mr. Speaker, I am being interrupted. Can you do something about it?
Put the question. You have many...
The Minister and his trusted advisor said on TV, in the papers, qu'il n'y a aucune urgence à se faire vacciner. Does he know, even though at that time there was no pandemic, is he aware of the horrible economic consequences of having our borders closed? And isn't it shameful of him that he was so misguided to say there was aucune urgence à se vacciner? And now the Deputy Prime Minister, the Attorney General, a few weeks later, are saying seule solution, vaccination. Mr. Speaker, will the Honourable Minister apologize again to the nation for being incompetent?
Once more, don't give lessons. First of all, Honourable Leader of the Opposition, withdraw the word shameful that you used and put a proper question.
I withdraw shameful in whatever context it was, if it upsets you. No problem.
Your question is over? Any answer?
Yes, Mr. Speaker, so let me start by first saying that the Honourable Leader of Opposition, I know this is your first day, you have taken Xanax, you're a little bit, a lot of abruti in you, I understand. You don't know how to formulate questions, I think, Honourable. I understand perfectly.
Honourable Minister.
Honourable Minister. Yes, sir, yes, okay. So I'll first start by what the Leader of Opposition has said, the pre-order. Did he know that once the vaccination development for the vaccines started, there were 200 candidates for the vaccines, the research. He would come to make a political point that we should have pre-order. Does he know what pre-order means? As an accountant, he should not know only figures. He should know also the administrative procedures involved. I said it in my intervention. What are the different steps involved in procuring vaccines? It's not just like going in a supermarché and just do it's an over-the-counter that you buy it. There are a lot of regulation. He should understand. He should make the population understand that we are in a pandemic stage. Vaccines take years to develop. And these vaccines have been given approval due to the emergency use. He should know that. And we have to be, at the same time, bring safe vaccine to Mauritius, but at the same time, we have to act fast. Second, he also said that his question was about on 4th of February. I don't know from where he's quoting that, from which newspaper that he's reading. In fact, if we started our campaign on 26th January, because we know that it is imported, taking any quote from any newspapers doesn't mean that I have said so. You are doing that blah blah. You are taking blah blah of any newspapers. The government has started preparing for the vaccination program since early December. In my intervention, I give it all the details. Can't he listen properly? All the details I've given to him about the procurement of vaccines. And at the same time, he is saying that I said in some press that the vaccines is not urgent. So why we have started vaccination as from 26 January, especially for the frontliners? Try to be frank and don't try to mislead the population, because I know this is the only opportunity that you have, or else otherwise anybody won't listen to you.
I am in the House, and the Minister is accusing me of misleading my colleagues here. Withdraw it, please. Withdraw it now.
Order here.
Withdraw it.
Mr. Speaker, sir, I want to know what should I withdraw. I won't withdraw till I don't know perfectly. If ever you have to go back.
Honorable Minister, withdraw the word mislead.
I withdraw the word mislead. And
Next
your
question.
mouth. Thank you, Mr. Speaker.
Get prepared.
Mr. Speaker, the Honourable Minister has given us a timeline. And it shows clearly that he has been dragging his feet for months and only now is panicking. I'm going to ask him something. Mr. Speaker, PQ bis 622. This is what he said. He said something at contrary at the same time. But this is what he said. It is, when talking about vaccination, Mr. Speaker, it is mostly for them, that is the old age pensioners and the persons at risk and the frontliners that were looking forward to this vaccine. This is talking, Mr. Speaker, about people with comorbidity, old age, etc. What we have found, Mr. Speaker, is what he's doing now, which is shameful also. You don't like the word shameful?
Not only you don't have a question, you're using words which are in Parliament. Withdraw the word yourself.
Absolutely. It is regrettable. Is that okay for you? It is regrettable, Mr. Speaker, that a small percentage of old people, 8% I think he said, these old people are maybe 50 times more at risk of getting severe COVID or death than anybody else. And he's giving priority, Mr. Speaker, to people who have, not frontliners, listen, to people who have work access permits. 200,000 people in Mauritius have work access permits. And he thinks that it's 200,000 people who are not really at risk because they are young, most of them, should have priority against 210,000.
Order first. Question time should not be a pretext for debate. Don't debate, honorable member. You put your question.
But still, there you go. It is, Mr. Speaker, very regrettable that he is complètement délaissé. The old people, 8% only have been vaccinated in favor of clients of Business Mauritius, who, as the Deputy Prime Minister said, are sending people, the best loads of people, to be vaccinated. I listened to you on the TV.
Question?
To be vaccinated. Therefore, Mr. Speaker, sir, will he stop this nonsense and revert to vaccinating persons who are...
The word nonsense is not proper. Withdraw the word nonsense.
Nonsense. Is rubbish acceptable, sir? rubbish? Will he withdraw this rubbish? Okay? And therefore revert to vaccinating all people, people with diabetes, people with heart disease.
Question, Honorable Leader of the Opposition. Be respectful to the chair. You should ask questions. This is your prerogative. This is question time. There is no time for statement. And you ask me to give you some more time. How am I going to do that?
Mr. Speaker, with all due respect, it is a question. That was a question. Maybe you missed it, but it is a question. Will he revert? That was my last sentence, Mr. Speaker.
Let me hear the question.
You heard it, but I'll tell it again.
No,
Will he revert to vaccinating people who are at risk? The old, the people with diabetes, these people with heart disease are 50 times or more liable to get severe COVID and death. And he's giving priority to clients of business Mauritius, who, as the Deputy Prime Minister said, are sending...
I'm sorry. I'm sorry. Don't make any comparison. State your question directly. I allow you to lay the foundation of your question, but you're making an abuse of the time of the House.
Missed the declaration of the Deputy Prime Minister. He said that Business Mauritius, as from tomorrow, will be sending people by busload for vaccination.
The Minister, Honorable...
He's not complaining.
Honorable Leader of the Opposition, the Minister of Health is not responsible for any article or any statement by... The thing is that you have to have a proper question. Why can't you have a proper question? I'm sure there are many interesting questions there.
My question is, Mr. Speaker, will he now revert? Is that not clear? Will he now revert to giving priority to all people, people with diabetes, etc., comorbidity, who have, this is the third time I give the question, 50 times more chance of severe COVID than clients of Business Mauritius?
Thank you.
Thank you.
Mr. Speaker, sir, I've explained it properly how the vaccination campaign has started, when we started doing vaccination for elderly, and when, as soon as the confinement was en vigueur, we started to do the vaccination differently. Mr. Honorable Leader of Opposition should understand that old age, they are more vulnerable to the risk of contracting the disease. They have been always, the Minister of Health always advised them they have to stay at home, stay safe at home. In this context, where we have local transmission, where there is a surge of the disease, we should allow those people to stay at home. They should not be allowed to go out of the home because it's very risky. The Leader of Opposition has to understand this. He should not mingle. He should not mingle what has been said. There is a vaccination program. And in fact, the government has acted promptly. During confinement period, we have been doing vaccination for all people that will be going out, will be in contact with the population, will work with the public. This is the strategy. And once this confinement will be over, we will again resume our vaccination program as it has been the priority groups. He should not make allegations on old age about their disease. We know that they are priorities. We know they are very sensitive. But now, allowing elderlies to go out of their homes and to do vaccination, this is not recommended. Second, Mr. Speaker, sir, the ministry has already given priorities to all those attending dialysis center to do the vaccination for the dialysis patient because they are attending our institution. They are moving out of their homes. Similarly, for those cancerous patients, we are doing vaccinations for those who are attending the hospitals. Why we are doing that? Because we know they are sensitive groups. And it's not what the Leader of Opposition is saying. I understand, again, you know, as a psychiatrist, I understand the effect of Xanax. Mr. Speaker, sir, Xanax, if you take it too much, it's not good for your health. And if you take it too little also, it's not good. Thank you, Mr.
Only crazy people would go and say doctor like this. I tell you, you have to be crazy to go and see him. Let me tell you one thing, Mr. Speaker. He has himself said that only 100 diabetes patients have been given vaccines. 100. Whereas there are something like 260,000 people suffering from diabetes in Mauritius. Are these people, all of them, supposed to stay at home and die of hunger because he has not given them priority?
Had a question. Answer, please.
Mr. Speaker, sir, I again said it. We are living in a confinement period. There is no transport facilities. These people have to stay at their home. The Ministry of Health had advised them, if only in emergency, in urgent context, to go to the hospital. They are attending local health centers to get their medicine, to get their, to get their treatment. And these people, we have to protect them in their house and not telling them to come and do the vaccination. He should also note that the vaccination, if you do it today, the effect will be after weeks. There is no emergency to do it in a time of confinement, in a time when the virus is circulating in the population. You have to be, we have to be careful for that. We have to be protective to the elderly and not as what he is saying.
Honorable Leader.
Thank you very much, Mr. Speaker. The Minister has made a confession de taille, as a result of which, because of policy failure and failure to preempt, there's a shortage of vaccine. Can we have it from him that he will give us a forecast as to how we will reach 74% of herd immunity by August? And will he table the document?
Mr. Speaker, sir, in my intervention, I mentioned it, that how the government, how the ministry is proceeding with the vaccination. No countries in the world, even those who are producing the vaccine, can give a timeline when they can vaccinate their population.
Quiet. You ask your question, listen. No, don't discuss with the chair. On this side, be quiet.
Mr. Speaker, sir, they are comparing Mauritius with Seychelles with a population of 85,000, and where they have been given Sinopharm vaccination. I will see what would be their reaction when the Sinopharm vaccination will come to Mauritius. I will see. Now they are saying that Seychelles have been vaccinated. Let's wait for their reaction when the vaccination will come to Mauritius. Now, at the same time, we have how the government has been preparing for the vaccine. It's not that the vaccination is available tomorrow, but there is a preparation. There is a commitment of the government how to procure the vaccination, and all that I've already given how the vaccination will be procured. But at the same time, Mr. Speaker, sir, the time frame that we don't know. We can't preempt now to say when will be the delivery time.
Sir, in answer to PQ B 992 last year, the Honourable Minister of Health stated, and I quote, that countries have been asked to establish a compensation mechanism to compensate individuals who might suffer from serious adverse effects associated with the vaccine. Being given that there was a commitment taken with COVAX to set up this compensation fund, why is the Honourable Minister telling us today that no such fund will be set up, and instead no one will be compensated and everyone has to sign a waiver exculpating government and everyone else from liability?
Mr. Speaker, sir, again, I think that the member, the honourable member, he has not listened to me properly. I've said that after consultation with SLO, the government is that we have the consolidated fund to, if ever somebody is suffering from any adverse effect, that consolidated fund is a compensation fund that we can use to do for any compensation. Now, at the same time, the compensation fund, which is required, has to get a cap. And the Ministry of Health and the SLO, we we can't value a person's life. It's better that we have it from the consolidated fund.
Honourable Leader of the Opposition, last supplementary.
Yes, Mr. Speaker. Well, I'll stay on this subject. Can the Minister perhaps tell us what are the parameters for compensation? Now, Singapore has just published the parameters for compensation, up to 7 million rupees for people with grave disabilities. Even given all the many months that he's had to think about this in his mind. Tell us now, please, what are the parameters for compensation from the consolidated fund?
That's what I said. In the compensation fund, we have to get the parameters. But in the consolidated fund, there is no lieu of such parameters.
Honourable Leader of the Opposition, show respect.
He is not crazy.
Show respect to the House.
I'm sorry.
Time over by 30 minutes.
Donc une séance animée pour cette private notice question du leader de l'opposition, Xavier Duval, adressée au ministre de la Santé, Kailesh Jagatpal. Donc finalement un échange très animé au niveau de la vaccination. Nous pouvons d'un petit moment l'aube une question supplémentaire qui finit posée. Alors d'abord dans sa réponse, le ministre de la Santé fin dire qui gouvernement peut considérer tout une marque de vaccin. Il vient de Pfizer, Johnson & Johnson, Sputnik, le vaccin chinois. Il dit qu'il pour un don du gouvernement chinois pour le vaccin Sinopharm. Sputnik, 250 000 doses de commandes finit placées. Le ministre Jagatpal fin dire qu'il est confiant que le gouvernement pour capable vacciner jusqu'à 879 000 Mauriciens, soit 82% de la population des adultes à Maurice. Alors, il dit que ce ministère finit établir deux scénarios, dépendant le moment auquel le vaccin peut être disponible. Tout un vaccin peut être disponible. Scénario N, 10 000 vaccins par jour et il dit d'ici août 2021 pour finir vacciner 62% de la population. Scénario 2, 12 500 vaccins par jour et d'ici août 2021, 74% de la population pour finir être vaccinée. Le ministre de la Santé fin expliqué qu'il fin arrête la campagne de vaccination pour un vieux dimoun parce qu'il est risquant pour faire maintenant sortir en plein confinement, il dit qu'après sa campagne-là pour reprendre. Concernant le consent form, le ministre de la Santé fin expliqué qu'il compagnie fabricant fin impose certaines conditions pour que Maurice gagne sa même vaccin-là et c'est pour ça qu'il fin bien établir un tel consent form et le ministre de la Santé dit que ce formulaire de consentement pas pour être amendé. Maintenant, dans la tranche des questions supplémentaires. Donc, Xavier Duval fin rappel au ministre Kailesh Jagatpal, déclaration qu'il a fait au Parlement en décembre 2020 pour dire que le ministre dit qu'il est dangereux, il est catastrophique si le gouvernement importe un vaccin qui ne peut pas encore être approuvé par l'OMS. Xavier Duval fin rappel au ministre de la Santé, déclaration qu'il lui-même lui fait au Parlement. Le ministre répond pour dire que maintenant le contexte local et international est complètement différent. Il dit qu'en décembre, Maurice Covid safe et là aujourd'hui nous avons une deuxième vague et il dit que pour bien prendre un vaccin pour être servi en urgence. Et il peut dire que le gouvernement ne peut pas prendre un citoyen pour cobaye. Le ministre Jagatpal fin acquise l'opposition de semer le doute dans la tête des Mauriciens. Et le ministre Jagatpal fin aussi évoque une raison économique pour dire qu'il fait bien vaccine la population parce que tôt ou tard, l'activité bien reprend, frontières bien ouvertes, nous l'économie bien reprend. Le ministre de la Santé dit de toute façon, même si l'OMS pas encore approuve certains types de vaccins, il dit qu'une organisation internationale de réputation approuve ça vaccin-là. Et le ministre dit que le gouvernement agir vite, mais pas dans la précipitation. Xavier Duval, leader de l'opposition, insisté, il dit qu'il accuse Kailesh Jagatpal de négligence et d'incompétence et il demande au ministre de la Santé de présenter des excuses à la population. Et le ministre de la Santé dit qu'il n'est pas capable, et là il peut répondre à une question supplémentaire du député travailliste ex-leader de l'opposition Ovin Boulel, il dit qu'il pour le moment pas capable de donner une timeline à quand exactement ça mène vaccin qui ne passe qu'au là, ça mène vaccin là pour être délivré à Maurice. Ovin Boulel accuse le ministre de la Santé d'être responsable de manque de vaccins qui est là d'après lui donc en ce moment dans nos pays. Reza Utim aussi rappelle le ministre de la Santé Kailesh Jagatpal qu'il étudie l'année dernière dans le Parlement, il étudie que le gouvernement pour bien établir un compensation fund pour compenser dimoun qui gagne effet secondaire grave à partir de vaccin qu'ils ont fait. Il dit que le gouvernement prend un engagement en décembre l'année passée. Il demande le ministre Jagatpal que sa compensation fund n'a été qui fait pas fin créer ça. Le ministre Jagatpal dit qu'il pas nécessaire de créer une compensation fund parce qu'il est capable de servir l'argent de consolidated fund pour capable éventuellement compenser dimoun qui subit adverse effects de vaccin. Xavier Duval demandé mais qui critère, qui paramètre, qui critère qui établit pour capable compenser un dimoun qui fait un vaccin. Et là, le ministre de la Santé donne une réponse assez bizarre. Il dit qu'il y avait Consolidated Fund, pas besoin et n'a critère. Donc, la séance qui est très animée prend fin sans doute là. Et là, nous trouvons Jagdish qui le gouvernement malgré qu'il y ait un vaccin qui peut encore être approuvé par l'OMS, le gouvernement peut dire qu'il besoin agir vite pour une raison économique et bien sûr pour protéger la population parce qu'aujourd'hui, Maurice peut subir de plein fouet une deuxième vague de Covid-19.
Oui. Alors, donc, avec sa private notice question, leader de l'opposition, nous en présence d'un plan d'ensemble de campagne de vaccination qui en cours, qui ne déjà commencé. Finena donc le débarrage avec ban frontliners depuis janvier et tout ça est bien expliqué en détail par le ministre de la Santé. On évoque ça deux scénarios là. Donc un premier scénario que nous pouvons être capables d'atteindre 62% de la population donc en août 2021 ou bien nous atteindre c'est-à-dire environ 74% de la population en août 2021 également. Donc, le time frame qui est fixé, là, il paraît qui est clair. Donc, nous avons un objectif, atteindre l'immunité collective en août, ça l'année-là. Et d'après le ministre de la Santé, Maurice, c'est-à-dire le service qui nous est disponible, nous avons sa capacité pour vacciner, c'est-à-dire environ 12 000 Mauriciens tous les jours, pour nous atteindre l'immunité collective. Ensuite, au niveau de vaccins qui nous supposait bien recevoir, il y a 400 000 doses déjà fini commandées, 100 000 pour gagner mi-avril et le reste en fin juin 2021. Donc, il fait partie de ça, order qui finit placer, c'est donc l'offre qu'il a une faire, à part de la donation, donc nous pouvons acheter un certain nombre de vaccins, 400 000 doses, c'est-à-dire de Serum of India. C'est une grande firme très connue et séparément donc qui peut faire la production qui est engagée dans la production du vaccin. Ensuite, au niveau de l'hôpital, il y a un aspect, Xavier Duval peut dire, est-ce qu'il n'y a pas besoin de privilégier vieux du monde il y en a 200 000, 210 000 Mauriciens qui concernés. Donc, donne autres priorité, qui donne priorité, ben, du monde qui peut gagner le Work Access Permit. Là, il y a les deux aspects qui vous été au niveau de la société mauricienne. Donc,
le ministre Jacques Pal dit qui ben vient du monde
reste la
case parce que pas qu'à prendre risque en plein confinement.
Oui, fait autres sorties parce que tu commences une campagne de vaccination en faveur de vie. D'ailleurs, tu donnes autre priorité également aux frontliners, mais avec le confinement qui finit de démarrer et donc qui finit de proclamer le 10 mars, donc il y a un ralentissement à ce niveau-là. Pour Xavier Duval, besoin d'une priorité, parce qu'il protège eux en avant, mais le ministre peut dire qu'il ne faut pas sortir dans un centre de vaccination. Et il y a une proposition pour faire dans le passé à la domicile, mais ça, il paraît une complication, il est aussi difficile. Voilà donc, nous en présence, quelle est la situation? Nous retrouvons-nous donc avec différents types. Donc, Maurice n'a aucune réserve au niveau de acceptation d'un vaccin de 6 types de vaccins qu'il peut produire, parce qu'il nous parle également en faveur de vaccins qui sont de la Chine, également de la Russie. Et là,
mais ce chiffre est important. Le gouvernement confiant Jagdish qui est capable de vacciner jusqu'à 82% de la population.
Oui, ça c'est très important, c'est-à-dire nous faisons 12 500 vaccins par jour, nous atteignons ça 82% de la population.
Non, avec 12 500, nous pouvons faire 74% d'ici août. Mais le gouvernement pensait qu'à terme, il est capable de vacciner jusqu'à 82% de la population.
Oui, alors 74%, c'est qui nous fixait les 62% si nous faisons à un rythme qui est défini, ou bien nous atteignons 74%, et le reste, donc, pour capable de continuer.
Et vous remarquez que ce soit le docteur Djoumaï, le ministre Kale Jagatpal, et même Steven de Bigadou, quand il vient dans nos plateaux, évoque sa période de juin, juillet, août. Hein? C'est-à-dire que le gouvernement a envie qu'il, pendant la première partie de cette année-là, finisse atteindre sa immunité collective-là, pour qu'il, dans la deuxième partie, c'est-à-dire à partir d'août, capable de réouvrir une frontière, parce que Maurice dépend beaucoup de l'industrie touristique,
oui.
Et ça, l'industrie-là, pas pour reprendre tant qu'il pas réouvert une frontière.
Oui, c'est ça l'objectif. Donc, l'objectif, c'est atteindre l'immunité collective avec 62% ou 74%, dépendant du rythme de vaccination qu'il nous peut faire. Et donc, à partir de la deuxième période de l'année, la deuxième partie de l'année, à partir d'août, quand nous avons besoin contre le touriste, nous rentrons dans la saison, ce qu'on appelle la saison de pointe du tourisme, à partir de septembre-octobre. Donc, c'est pourquoi donc, ça programme-là, il est établi comme ça. Ensuite, Xavier Duval, une cause de la question de compensation, il fait mention de Singapour, qui nous propose un montant de 7 millions de roupies, et donc pour tout cas de grave disabilities, en cas de vraiment de complications graves liées à un vaccin, donc un citoyen singapourien qui peut avoir droit à jusqu'à 7 millions de roupies. Fin demande le ministre, est-ce qu'il est capable, on mentionne Nawaz, fixer un paramètre, donc nous ici un plafond pour qui, c'est-à-dire définir un montant qui est capable de payer. Mais le ministre dit, ça c'est une question, il fait partie, puis un fund, une compensation, une compensation fund qui est établi, c'est le Consolidated Fund, et ça nous besoin rappeler à nos auditeurs, le Consolidated Fund, c'est un fonds qui est ramassé par le gouvernement, et il y a beaucoup d'argent qui a dedans.
Ouais, par exemple, l'argent de loterie.
Loterie, c'est un fonds très indépendant, et à chaque fois il y a une calamité, une difficulté, nous puise du Consolidated Fund, chaque année, beaucoup casse, et il y a même une partie de l'argent qui prend du Consolidated Fund pour balancer le budget quand nous avons un budget supplémentaire dans le courant de l'année, qui besoin d'avoir une dépense additionnelle pour faire, c'est dans ce fonds-là qui nous puise donc l'argent pour faire une dépense. Alors, en cas une demande de réclamation par un citoyen qui vous sentit qu'il fait une victime ou bien il fait c'est-à-dire le vaccin fait une porte atteinte à la santé, ou bien finir la négligence médicale. Donc, c'est le fonds, le Consolidated Fund, qui peut utiliser d'après le ministre de la Santé.
Voilà, moi, je peux dire une séance de la PNQ très animée. Peut-être nous capable de cause de là un petit moment parce qu'il a un petit peu les temps. Alors, un échange pas fin temps entre Xavier Duval et Kailesh Jagatpal. Xavier Duval fin accuse le ministre d'être un stupide et Xavier Duval fin dire qu'il imprend Xanax pour être capable contrôle sonné pendant la PNQ. Et là, le ministre de la Santé fin dire qu'il Xanax, il prend lui trop beaucoup, bah pas prend lui assez, il est capable d'amener l'effet de la santé. Et Xavier Duval fin dire un psychiatre comme Kailesh Jagatpal, besoin de moun fou même qui a le donc échange pas fin temps. Et le Xavier Duval fin accuse le ministre d'être une catastrophe, alors que le ministre fin dire que Xavier Duval a sur une oreille qui est catastrophique parce qu'il dit pas écoute ben réponse qu'il lui donnait. Fin le point de droit d'Alan Ganou quand Xavier Duval fin demande à Kailesh Jagatpal répondre là ce qui Manish Gobin fin dire, il fin accuse Manish Gobin d'induire la population en erreur, le consent form. Et là, Alan Ganou vient soulever un point de droit pour dire qu'un ministre au Parlement pas capable de répondre au statement qu'un autre collègue ministre fin faire. Et aussi, Jagdish nous trouvait que le speaker fin besoin intervenir à plusieurs reprises et il vient besoin recadrer le leader d'opposition pour dire qui question time, c'est un moment pour poser une question et pas faire un long statement, alors qu'ils avaient du mal pour dire qui pour être capable de poser une question, bien capable d'une mise en contexte qui fait. Alors c'est un exercice bien délicat, veut dire le speaker.
Les tranchants dans le sens.
Il vient leur prérogative à un speaker. Alors un speaker il est capable de donner une certaine flexibilité au leader de l'opposition pour qu'il dise ce qu'il a pour dire.
Il développe
ça qu'on appelle laying the foundation of a question. Et un speaker flexible là, mais un speaker qui est rigide là. Et donc nous trouvons qu'il sur du défaut qu'il a, il est plutôt un peu rigide. Il dit qu'un leader de l'opposition dans question time, bien poser 10 questions. Il est capable de faire certains commentaires, mais il n'est pas capable de faire un long statement. Donc, et puis, bien sûr, finalement, la remarque de Kailesh Jagatpal à Xavier Duval pour dire qu'il met, ou même aussi, le consent form.
Ouais. Et Xavier Duval, il répond, c'est un acte de patriotisme. Les bisins donnent le bon exemple. Nous pas connaissons les fins de proteste, mais donc, c'est-à-dire, donc, d'après lui, il peut abide par un règlement qui finit mettre en vigueur. Et ne pas oublier que Xavier Duval a une longue expérience de l'opposition. Il finit 16 comme leader de l'opposition du 20 décembre 2016 au 14 novembre 2019. Donc, il n'est pas c'est-à-dire un novice dans ce poste-là, mais seulement, comment on peut mentionner, Nawaz, donc il a cet aspect de développer un thème avant de venir avec une question, c'est-à-dire Xavier Duval, il nage un peu l'âge, après jusqu'à pour y arrive au point.
Mais le risque, Jagdish, quand un leader de l'opposition fait ça, le risque, c'est qu'il est capable, parce que ça provoque une réaction du côté de la majorité. Donc, pour une protestation, le speaker peut intervenir. C'est qui est arrivé les temps passés.
Oui.
Alors que le style de Reza Outim, beaucoup plus direct et percutant.
Oui.
Reza Outim, quand il pose une question, il fait référence à une telle déclaration que le ministre fait, il cite le PQ
et il pose aux questions.
Oui. Donc, je pense que ça, c'est un style qui est plus productif, à mon avis, pour poser une question directe, pas perdre le temps. Parce que si vous faites un long statement, pour une réaction de l'autre côté,
irritation de l'autre côté.
Le speaker peut vous intervenir. À ce moment, il y a une question qui prend 5 à 7 minutes, juste une seule question. Alors qu'on pose une question directe, le ministre répond. À partir de là, je pense capable d'un meilleur flow of questions qui suivent.
Oui, et d'ailleurs, nous remarquons qu'il y a 60 minutes qui est consacré donc au private notice question de Xavier Duval. Donc, il est vrai, c'est un sujet d'importance, de grande importance nationale. Donc, nous tout préoccupés avec la question de pandémie, l'épidémie et aussi le confinement. Certainement, donc, le speaker finit un peu flexible, mais tranchant dans le sens, pas fin laisse le leader de l'opposition faire référence ou bien répondre, que le ministre réponde loin de l'autre ministre, par exemple, quand il mentionne et donc Manish Gobin sur une déclaration à la presse. Et aussi, en début de séance, finalement, l'hommage rendu à l'ancien ministre Maurice donc décédé récemment. Il fin début de sa carrière en 1976. Il fin un trésorier du MSM, ministre de l'Énergie. Donc, il est forcé à la démission, il est vrai, autour d'un scandale de turbine à gaz. Alors, donc, il est très actif avec surtout Saint-Héro Jagnat dans la circonscription de numéro 7, donc Piton, Rivière-du-Rempart.
Et une autre remarque, Jagdish, pendant près de 30 minutes, qualité son parti bon au niveau du Parlement. Et pourtant, il y a une production unit qui est responsable du live broadcast. Donc, ça, c'est un problème technique, mais ce qui me trouve assez grave et inacceptable, qui pendant de longues minutes, près de 30 minutes, sont pas bons.
Oui, un mauvais ajustement au niveau du son.
Mais au niveau, il y a un technicien qui dans sa production unit là, donc s'ils sont pas bons pendant 1 minute, 2 minutes, 5 minutes, ok, mais là, 25 à 30 minutes sont quand le ministre Jacatpal fin répond tout au long de son réponse, la qualité du son n'était pas bonne. Donc, on espérait que la prochaine fois, technicien de la production unit régler ça au plus vite.
Oui, et nous pensons que le production unit, il y a encore une situation de période de rodage, quand après tant de temps, depuis Maya nous mandi son mandat comme speaker, nous peut assurer, donc c'est-à-dire du Parlement peut assurer les travaux parlementaires en direct et chaque mardi.
Voilà, à venir maintenant le journal complet avec Dushila Mansingh. Bonne écoute sur Radio Plus et sur l'info qui continue sur le www.defimedia.info.